Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today, our lecture about evidence levels and the guidelines or recommendations. We want to know what is meant by evidence levels and guidelines or recommendations. So, the objectives of this lecture, including classification of studies, and I have a previous lecture about overview of study designs. I hope you can see this lecture on my YouTube channel in details. Okay. Second is the classification of evidence levels 1, 2, 3, and 4. Third is the grades of recommendation A, B, C, D. And you can see here the hierarchy of the level of evidence. As you see on the top of the preferred study clinical study designs is the meta-analysis and systematic review and randomized controlled studies, double blind or triple blind, and so on. So let us start with the classification of studies. We have three big categories: observational studies, interventional studies or experimental studies, and meta-analysis. Observational studies including 4C: case series, case control, cross-sectional, and the cohort. Which is the preferred in this 4C is the cohort prospective study. Okay? Which is preferred as the clinical study, observational or interventional? Interventional study. What are the types of interventional study? Controlled and uncontrolled. Of course, controlled is better than uncontrolled. And not only that, controlled double-blind study to decrease the bias. Okay? Double-blind or triple-blind. What is meant by that? If you are comparing drug A by drug B, for example, in this study, the patient don't know which is the drug she is taking, A or B, and the doctor who is doing the study also don't know. So this is called the double blind study. Single blind, the patient don't know only, but the doctor know. Double blind, both of them don't know. Triple blind, those who are doing the statistics also don't know who is the patient taking drug A or drug B, for example. Okay? So, controlled interventional study, clinical trial, double blind or triple blind is better than uncontrolled, of course. On the top of the hierarchy of level of evidence, meta-analysis. Meta-analysis and systematic review. Here, a quantitative statistical analysis of several separate but similar studies. So, I have controlled clinical trials in a multi-center study in a certain problem or disease or medications. We are comparing medication which is better for treating certain disease, and you have many randomized clinical trial, double blind or triple blind, in a multi-center study. We collect all these data and doing analysis, so we're reaching the top of the level of evidence of the pyramid as we see before. Okay, so this is the observational study, interventional study, and meta-analysis and systematic review. Okay, of course, the weakest in observational study is the case series or case reports. This is the weakest. Okay, so let us go to the classification of evidence levels 1, 2, 3, and 4. Let us start with the evidence level 1 plus plus. What is the explanation of this level of evidence? 1 plus plus means a high quality meta-analysis, systematic reviews of randomized controlled trials or randomized controlled trials with a very low risk of bias. 1 plus means well controlled, well conducted meta-analysis, systematic reviews of randomized controlled trials or randomized controlled trials with a low risk of bias. So, what about 1 minus? Meta-analysis, systematic reviews of randomized controlled trials or randomized controlled trials with high risk of bias. With high risk of bias. Of course, when the bias increase or there is high risk of bias, this dropping down the evidence level. Okay. Let us go to evidence level 2 plus plus. What is the explanation of this? High quality systematic review of case control or cohort study or high quality case control or cohort study with a very low risk of confounding, bias, or a chance and a high probability that the relationship is causal. What about 2 plus? Well conducted case control or cohort study with low risk of confounding, bias, or a chance, and a moderate probability that the relationship is causal. 2 minus means what? Case control or cohort study with high risk of confounding, bias, or a chance and a significant risk that the relationship is not causal. Let us go to evidence level 3. Evidence level 3, non-analytical studies. Example, case report, case series. You remember the pyramid of the general hierarchy of level of evidence? Okay. On the base of this pyramid is the case report and the case series. Okay, so non-analytical studies like case report and the case series take 3 in evidence level or evidence level 3. What is evidence level 4? This is the expert opinion. Okay? This is the expert opinion is considered a level of evidence as grade 4 or level 4. Okay? This is the expert opinion. What about grades of recommendations? We have 4 grades of recommendation: A, B, C, D. The most powerful and the best is A, of course, and the lowest is D. A, what is the explanation of grade A recommendation and guidelines? Okay, at least one meta-analysis, systematic review, or randomized controlled trial rated as 1 and directly applicable to the target population, or systematic review of randomized clinical trial, or a body of evidence consisting principally of studies rated as 1 directly applicable to the target population and demonstrating overall consistency of results. So what about grade B? Recommendation B, a body of evidence including studies rated as 2 directly applicable to the target population and demonstrating overall consistency of results, or extrapolated evidence from studies rated as 1 or 1 plus. So what about grade C recommendation? Body of evidence including studies rated as 2 directly applicable to the target population and demonstrating overall consistency of results, or extrapolated evidence from studies rated as 2 Let us go to grade D. Grade D, evidence level 3 or 4, or extrapolated evidence from studies rated as 2 Okay, what about good practice point? Recommendation and the guidelines, when we say this recommendation is a good practice point, what is the explanation of this? Good practice points recommended best practice based on the clinical experience of the guideline development group. So this depends on the experience of the guideline development group who are sharing in this guideline. For example, this is their clinical experience. Okay, so this is the recommended best practice based on the clinical experience of the guideline development group. We call it good practice point, or GPP. This is the end of this short lecture about level of evidence and recommendation or guidelines. I hope you can see my video about overview of study design with more explanation to different types of studies. Thank you everybody. Wishing you all the best.